Good afternoon to everyone present here with us today. This is Shreyan from IGCP. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker, Doctor, for today's session. With much pleasure and honor, I would like to welcome a very renowned Professor Dr. S. Arul Raj. Sir is an MD, PhD, FRCPG, FRCPL, MBA, and Dr. B.C. Roy National Awardee and Distinguished Professor at Dr. MGR Medical University, Chennai. With the help of Sir and his wonderful insight, we will be taking a close look on today's topic, which is keeping your heart health. Now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him for his precious talk to begin with. Over to you, Sir.
Thank you, Shreyan.
Thank you, sir.
Our World Heart Day, great wishes to all the participants. Today is the World Heart Day as agreed by or declared by the World Health Organization. For major diseases, we have a day. Why we have this day? This is to strengthen the hands of doctors and make the public aware that they should take care of their health. That is the meaning of this World Heart Day today. Right from morning in our institution, we have been celebrating. And I will just, pass on through certain messages for you, how to keep your heart healthy. And you can always listen to it. I am sure you will have a lot of queries on that. Whenever I talk on this subject, there are a lot of queries on that. Sure, you will also have it. I will try to explain it to the possible extent. First of all, see, health, you must understand, as said by WHO, it is not simply an absence of disease. You don't have a disease doesn't mean you have health. You must have physical health, mental health, social health, and spiritual health. All these are components of health. And coming to diseases, there are two major groups. One is due to infections. We call them as communicable diseases. And most of the developed nations have totally conquered that. India is also conquering it. Recently, we had COVID. Now we are down with dengue. And these infections are still existing. But the number is very less. The second component is the non-communicable disease. That is without infection. Without bacteria and virus, you get it. They are the most important diseases today. We call them as lifestyle diseases also. This includes the diabetes, hypertension, dyslipidemia, and coronary artery disease, stroke, cancer, and accident and trauma. They are very important today in the health of the individuals. In the non-communicable disease group, there are accounts for 63% of death of humans, not only in India, globally. Cardiovascular disease tops on that. That is why on World Heart Day, we are talking on that, and followed by the lung problem, chronic obstructive lung disease, something like a wheeze, cancer, diabetes, others. There are 4 common causes for them as per WHO. There is an unhealthy diet. We will see what is that unhealthy diet. Physical inactivity. Earlier, we used to call it as an exercise. Now we call it physical inactivity. Harmful use of alcohol and tobacco use. This is the statement by Government of India also. The diseases due to the lifestyle, as we discussed, coronary artery disease, myocardial infarction, top on the line, followed by diabetes, hypertension, obesity, dyslipidemia, and depression here. And the diseases endangering life in the world today, cardiac diseases are number 1. Number 2, cancer. Number 3, our traffic accidents. Number 4 is, HIV, AIDS, and COVID, and even sepsis. And what are when we say about heart, we are all very much aware of myocardial infarction, which colloquially we call it as a heart attack. And what are all the other heart diseases that can occur? One is, as I said, a myocardial infarction or a heart attack. And there are 4 4 pouches or 4 chambers. They have valves, in between for exchange of blood. There can be disease. There is a heart muscle. There is a cover called as pericardium. There can be diseases. There can be infection on the valves, and heart has a rhythm. We call it as a sinus rhythm. Regularly, your clock is there. Regularly, every half an hour it should come, or 15 minutes or 1 hour. If there is a change, we call it as a dysrhythmia. The rhythm is changed. That's a very common disease nowadays. And heart diseases are, divided, broadly into inherited and acquired. Inherited is what you are born with. Can be a blue child, total body and lips and hand and nails are all blue, or can be without cyanosis. There can be a muscle disease of the heart also, which is part of birth. After birth, first is again a heart disease. As I said, a valve problem, a heart muscle problem, or the cover problem, we call it as a pericardium. And we'll focus more on, heart attack or myocardial infarction worldwide. 1/3 of the world's population has cardiac disorders. 80% of the population in developing nations, India is a developing nation, they have cardiac disorder, out of which 60% is preventable. That is why this, this year, the World Heart Day message by WHO is use heart, no heart. That is a very important message. Indians genetically are at a higher risk of developing myocardial infarction. What is that heart attack, myocardial infarction? See, all of us know heart is pumping the blood throughout the body. Right from, head to foot, it is pumping. Without that, body cannot live. For that, heart also, we need a blood supply to survive. This is occurring through certain vessels, which we call them as coronary arteries. There are 2 major coronary arteries and 1 minor coronary artery. And in these blood vessels, we call them as channels or pipes, whatever name you give it. When they are slowly blocked, that leads to, and this is the channel that is supplying. Slowly it is blocked, and beyond that, if the blood, if the water, in a field is cut off, all the plants beyond that level die, and they totally, die. Like that, here it is blocked. This portion of the heart muscle dies, that is called as infarction or dead muscle. And this is due to the slowly the lipids get on accumulating, and once they block it, you get a heart attack. This is a known fact. Most of you may be aware of it. Why it comes? There are any number of causes for it. We divide them into 2 major classes. One is non-modifiable. You cannot change. Genetic, your parents had it, you will have it. Family, and males are more prone. Women are less prone. But today, women are also equally getting it. There are certain risk factors which are modifiable. That is what I am trying to convey you all through this communication. One is hypertension, the high blood pressure, and sugar, and overweight, obesity, dyslipidemia or fat, smoking, alcohol, a lot of, stress, what we call it as a depression. These are all the factors which are modifiable. Let us focus on these factors. This is how the heart attack process comes. There is an unhealthy diet, sedentary lifestyle, smoking and alcohol leads to diabetes, hypertension, fat, and obesity. And this fat is slowly deposited throughout the blood vessels. We call it as a pipes. Water to be fed to the plants, you need a pipe. Like that we have, blood vessels, and they are blocked. That goes to a heart attack. I think I have conveyed you, how it comes in. And what is the presenting symptom? A patient has got a heart attack. How would you recognize it? Chest pain is the most common. Chest pain is the most common. It is like a pressure. It is like a pressure. 4 kilos are kept on the chest and compressed, usually in the middle, and it radiates to the neck. It can go to the arm, usually left side. It can go to the right side, back also, even to the abdomen also it can come. Sometimes they may present with breathlessness or breathing difficulties, or they may present as giddiness, or they may present as palpitations, a fast heart beating, vomiting, loose stool, sweating, some memory disturbance, neck, shoulder, back pain. And another important presentation, nearly 30% of the people suddenly die. They just hold their chest and fall down dead. That is a sudden cardiac death syndrome. And you must all remember that this can occur, without chest pain also, especially in diabetic patients, this can occur. That all the medical professionals know that they should keep it in mind. And to confirm, whenever there is a patient chest pain is coming, how to evaluate? Clinically, you examine the patient, there will be some changes in the heart sounds or murmurs. And secondly, the ECG is the gold standard, usually abnormal. Very, 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 very rarely it can come little later, but usually abnormal. And a laboratory evaluation, echocardiography or an MRI of the heart or a coronary angiography is the final court of appeal. Based on that only we make the diagnosis. Here it's treadmill. You are made to walk on a small platform which is moving, and your heart is being checked here. And this is an echo, old echo. It's a black and white, which I have been doing. Now the youth use color. Echo. This is in coronary angiography. You try to enter into the blood vessel of the patient, see that, and if there are any blocks, we try to open it up by doing an angioplasty, doing a stenting. This is an ECG gold standard. When these changes occur, this ST segment changes, we always say that there is a myocardial infarction or a heart attack. Depending on where it is, we can locate the blood vessel also. Angio is done. There is a block. Stenting is done. Block is overcome. Sometimes we are not able to overcome the block or multiple crucial blocks. You may have to open up the chest, do a cardiopulmonary bypass. When there is a rhythm disturbance, as I told you, a pacemaker may have to be, implanted. And how to prevent a heart attack? Now we have seen something about heart attack, how it comes, how to confirm and treat, how to prevent heart attack. Your diabetes and blood pressure must be under control. Your weight should come down to ideal weight. Avoid tobacco and alcohol. Avoid stress and lifestyle changes. We'll just see them a little into it. This is what technically I have put it here. This is the so-called lifestyle changes. Your blood pressure, fat, obesity, diabetes, everything comes down, and we should bring it down. And first we'll talk about the diet. When we talk about the diet, these are the few components of the diet. One is a calorie, how much of calorie each gram of food gives, and what is about fat, what is about carbohydrate, vitamins, and minerals. In today's, very fast life, we have hurry. We are hurrying, and we have a lot of worry. We take a lot of curries, a lot of, food with oil and masalas. That all leads to bad one. These are healthy food. This is vegetables, greens, pulses, small fishes, boiled foods, and less salt. It is always healthy. Non-veg food, sweets, fried foods, deep frying, in the oil, and fatty foods, binge intake. You need only 2 idlis, you take 7 idlis, or 4 chapatis, you take about 7 chapatis. They are all binge feeding. It's all very bad. This is a food guide pyramid which we follow. See, the base of the pyramid is, broad. These are a few things which can take little, liberal, about 6 to 10 servings. These are all the fruits and at least 2 servings. Here, some of the non-vegetarian foods, you take it, little, 2 to 3 servings. And fats, oil, sweets, we use very sparingly. That way, if you could plan your diet, you will develop a good health, and you can prevent a heart attack. Yeah, this is called a therapeutic lifestyle change diet. Carbohydrates at least 45 to 60%. You will have to take it and try to avoid sugar and nutritive sweeteners, but non-nutritive sweeteners can be taken. One fact all of you should understand. You feel that you take rice, but you change over to wheat and ragi, I will be all right. No, all the 3 of them have same value, but rice, it quickly absorbs into the blood and raises the sugar. Ragi goes little slow, and refined sugar raises glucose quickly. Use complex carbohydrate, whole grains, and reduce rice and add vegetables and greens. It is the numbers that play the trick. Everywhere, including health and politics, numbers are very important. Secondly, about the protein, it is better to increase the protein in the food, usually about 15 to 20%. You can even go about up to 30 grams of protein, can be vegetable protein or animal protein. mixed with the leafy vegetables, it is a very good food. And thirdly is fat. Here there are 3 types of fats available. Saturated fats, let us avoid. Unsaturated fat, MUFA, and polyunsaturated or monounsaturated, you can take it reasonably about 10 to 15%. And today the nuts, walnuts species are being recommended. This is an analysis of the blood. When your blood is checked for fat, these are all the 5 factors which we check. One is a total cholesterol, should be less than 150 milligram. And this is an LDL, low density, less than 100. VLDL, less than 30. Another is high density lipoprotein, HDL. We call it as a good protein. This protein prevents the atherosclerosis or the plaques that is being formed inside the blood vessels. And this is triglyceride. This is very common in Indians because we live on rice. Rice and carbohydrates causes triglyceride, which should be below 100. This is the normal range. You can check yours. And the meal plan, we have 3 types of 3 major meals and 3 snacks. One is a breakfast, another is a mid-morning, another is a lunch, another is a tea time, another is a dinner, another is bedtime. You can you can classify or you can add up your calories based on that. These are certain foods which we have to avoid. It's Eat Right India. FSSAI has said avoid trans fat. These pakoras, bhajis, samosas are very bad, which we enjoy. This is in South India. This is an Indian junk food, which is a very important food. In South India, that is a parotas. And these are all fried pakoras and fried rice. All of them are having a lot of fat and trans fat, which is very bad for the heart. These are the, non-vegetarians and biryanis. All of them have a lot of cholesterol and trans fat, which are bad for the blood vessels, which lead to cardiac problems. How much to take? As I told you, there is a calorie value. 1 gram of carbohydrate and protein have roughly about 4 kilocalories. Fat has 9. You can calculate for a 50-year-old man, around 2000 kilocalories is the daily requirement, which he can divide it. I'll come back to you again. This is a calorie distribution. Carbohydrates about 45 you can have, and proteins around 15 to 20, fat around 15 to 20, and other micronutrients and fiber you have another 10 to 15%. This is called as medical nutrition therapy, MNT. Nutrition has become a science. It should be a prescription rather than advice. And as I told you, rice, wheat, ragi are same calories. Numbers are very important. How many numbers? How many chapatis you take? I take 10 chapatis, you are gone. I take 2 chapatis, you live healthily for a long time. This is about the calories. There are certain basic calories, as I told you. 20 calories per kg of ideal body weight is a need. A low-calorie diet is around 120 kilocalories per day. Very low density, because for obese people, we give 800. And hypocalorie diet is 500. It is very tough to follow. Isocaloric and equicaloric diets have been recommended with carbohydrates, fat, and protein. And a medical starvation diet has to be avoided. You will have to balance for festival travels and pregnancy. The message here is fasting. Don't fast. Just not good. Don't feast. Both are bad. And daily calories, I in my practice used to say, for around 40, morning you can take 3 numbers. South Indian take idli dosa. North Indian take chapati. And night you take 2. Calories are around 1300. Morning I recommend them a small cup with which could be filled up with cooked rice, 400 size. And same thing can be done up to 60 years. At 60 and beyond, I recommend them to withhold rice for the noon. Same idli or chapati they can do. And porridge is your enemy. As a physician, I would like to say, anybody taking porridge, either a rice porridge or a ragi porridge or wheat porridge, kanji, that is very, very bad. Food is medicine. We must remember that. And for the cholesterol and saturated fats, we should avoid white of the egg, fatty meat and inner organ meat like liver, butter chicken, butter fried fish, and the milk products. Unskimmed milk products are very bad. And in bakery, a lot of hidden, fats are there. And coconut and palm oils have a lot of fat we should avoid. Foods high in unsaturated fats, oily fish, avocados, nuts, seeds, sunflower, olive oil, vegetable oils are good. The mystery of PUFA and MUFA. Saturated fats increase cholesterol, therefore avoid. Coconut oil, palm oil, vanaspati ghee. Monounsaturated and polyunsaturated oils are good. Olive oil, groundnut oil, sunflower oil, all are good. Omega-3 fatty acid. And in the trans fatty acids always increase when there is deep fry. A pot full of oil you have, and you put the material, either vegetarian or non-vegetarian, do a deep frying, that is very bad, and you get into trans fatty acids. This is a culture in our southern part of the country. I wrote this article in 2011 in a local newspaper, that if you continue to eat parotas, you will get diabetes. There was a big debate. I raised this. These are the hazards of parota. Parota is made of a powder called as maida. How maida comes? It comes from wheat. We just wash it with hydrogen peroxide. The hydrogen peroxide can cause cancer. And then it is washed with alloxan, which can lead to diabetes. And it is fried in oil, leads to myocardial infarction. These are the health hazards of parota. There was a debate whether it is naan. We do that in North India, and fried mutton. And they said the naan has more calories than fried. In naan you have 290 kilocalories, whereas in here, in fried mutton you have 195. But we eat 2-3 naans. We should be very careful. And this is what I used to always stress. You take well-munched soft food, you live for 100 years. Whereas you eat this junk food, your tummy becomes like that, and it will reduce your life. And this is colored foods and colorful foods. See, always you must, use colored foods, that is greens, vegetable, fruits. And colored foods are chicken 65, cauliflower 65. Artificially colored foods you must always avoid. This is the culture today throughout the country, throughout the world. And I always used to say you are eating to live, but you are not living to eat. Many people, when I ask what job you are doing, I am eating. It is not the job. You are taking food only to live. And secondly, this is called as exercise. It is a physical activity. A sedentary life will lead to more diabetes and hypertension and heart problems double. Therefore, you should have physical activity. These, exercises cause you all these positives. Your blood pressure comes down, peripheral resistance, sugar, and obesity all comes down. Your heart rhythm also becomes normal. These are the advantages. These are all now increasing today, this pause and all exercise ones which we should do. 1 or 2 words about obesity. That's overweight. About 1.1 billion adults are overweight, and the number has tripled over last 2 decades as per a great journal. And it increases the mortality and morbidity of type 2 diabetes, coronary artery disease, stroke, hypertension, etc. That is how obesity comes. Your energy intake is more, your energy expenditure is low, leads to inflammation, insulin resistance, leads to diabetes, fat in the liver, and it increases blood pressure, your prothrombotic state, fat level increase, ultimately leads to a heart attack. That is how the obesity leads to. How to control it? Eat less salt, no sweet, no fatty food, exercise. WHO today calls this a physical activity. There are 2 types of obesity. One is this, pot belly. The apple type of obesity is very, very bad. This leads to a lot of this called a central obesity. Leads to a lot of metabolic problems. This is here, the central obesity. The sedentary life leads to sadness in future. And tobacco, there are no compromise that we should avoid it. Not only lung, coronary, kidney problems it causes. Alcohol, many literatures say that in moderation it is good. But what is the moderation? That's a difficult thing. For human, there is nothing called as moderation. And always we say by sitting in France, this Red wine is good. Let us go to France and see. But as far as in India, alcohol is totally not good. It increases the heart attack. It increases heart muscle problem, BP, fat, and obesity. Therefore, for Indians, we should totally ban alcohol. And there are now, see, earlier when I was started my practice, I am in practice for nearly 50 years. I used to get heart attack in people beyond 70, 65. Now we get even up to 24-year-old youths. And as per the hormone status, women do not get myocardial infarction. In their childbearing age. Today, 24, 22, all women and men get myocardial infarction. We call them as young myocardial, young youth below 40 years. This is due to stress. It is due to sedentary life, tension, a genetic risk, eating, smoking, more of screening time. Today, all youth spend time in mobiles or in digital side. That all leads to young myocardial infarction. And the stress, the exit point is smile. That is, you must share your problem or your issues, get motivated, develop deep interest in health, lifestyle changes, and health, and you must eat healthily. And science and lifestyle. See, there is lifestyle medicine is a separate, science today. I have written a basic book. This relaxation and yogas reduce the cortisol level and HDL increase, fat is coming down and depression goes out. Therefore, it gives you, good, relaxation. Any type of yoga you can do. Either a pranayama or any type of yoga or simple breathing exercise are good. These lifestyle changes wins, ladies and gentlemen. It wins heart attack, diabetes, BP, overweight, fat, and asthma, gastric ulcer, and stress. These are all the diseases which can be changed by lifestyle. Now, the prevention of heart attack, you must remember 6 E's. One is eat healthy. Healthy means it's content and number. Exercise means physical activity. You can do physical activity in your own work. You can sit, instead of sitting and doing the job, you can walk and do the job. Emotional breaking. Don't get into a lot of stress. Share your emotions. Exit addiction. Evaluate the numbers that you eat and the numbers that you weigh, the numbers in your sugar, numbers in your blood pressure. You will have to exit from stress. Always, stress could always be eased out. Now, friends, the message that I want to pass on to you is, if you want to keep your heart healthy, restrict your diet. Whatever you take, chapati, idli, dosa, less numbers. I have given the numbers as per the age. And exercise, physical activity regularly. You need not every day go to beach and run. You can just go around his house and water your plants and clean your car. There is a steps you just avoid a lift and climb. That all is very good for you. And never smoke or consume alcohol. Always take medicines regularly. Proactive screening. After the age of 40 years, you just go for screening. Proactive, either for sugar, BP, heart. See, people take drugs for many years in our country. Anybody can get any drug in the pharmacy and any number of rupees without doctor's prescription. They continue, but they don't do a checkup. Then they don't know whether they are right or wrong. And live in harmony, live in peace with friends and colleagues, family members. Keep your blood sugar, blood pressure, and stress under control. Friends, now you will understand healthy heart is not in doctor's hand. Doctor will save your life when you get a heart attack. But healthy heart is in your hands. Now this World Heart Day, my message is, healthy heart is in your hands. If you can take care, your heart will be healthy. You will have a lively heart. This is the WHO, where as a Commonwealth President, I used to be a member, and it used to be written there, disease, disability, death, prevention is by lifestyle. Is a statement for WHO. That's a message for this World Heart Day. I'm sure all of you, will be benefited by this communication, and any inputs from any of the participants, I would love to have. I'm here and participate. Thank you. Thank you all very much.
Thank you, sir, for your wonderful presentation. So we have few questions from our audience if you'd like to take that up.
Okay. I told you they will always ask for it because a lifestyle means they will always ask. Usually
Yeah.
in food and alcohol questions will be there, I am sure.
Yes, sir. So, sir, the first question from our audience is, what is the disease progression of Mediterranean diet effect on type 2 diabetes?
Vegetarian.
Mediterranean.
Oh, Mediterranean diet. See, Mediterranean diet is good, but whatever it is, the number has to be less. The calorie value has to be less. Then it will be excellent. It will be excellent. You can follow.
Thank you, sir. So the next question from our audience is, what is the association between healthy eating patterns and risk of cardiovascular diseases?
When there is a healthy eating pattern, what is healthy eating? You must eat the less number of the food and right food. That is a low calorie, low trans fat, low cholesterol. When you take it, always the cardiovascular disease will be reduced. I mean, incidence will be reduced. Depending on what other factors you have sugar or BP, family history. Even if you get a heart attack, you will usually come out of it and you will not again get into it when you eat healthy eating. That is why even Government of India has come out with the principles of healthy eating that we should follow.
Thank you, sir. Another question from our audience is, what is the impact and portion of dietary fiber in atherosclerosis and cardiovascular disease?
Highly positive. If you take a lot of fiber, you can be very much relaxed, your heart attack will not be there. And that is a regular need of it. Fiber is mostly from the fruits, vegetables, and the pulses, which you should take. That should be the main food. After 50 years, always leave the junk food and come to this fiber and this, vegetables and fruits and greens. That is the food. That is what I call as a colorful food. Your plate should be colorful, but not colored.
Thank you, sir. The last question from our audience is, can you please show some light on heart rate variability in patient with anxiety disorder?
See, a heart rate disorders, we call it a heart either goes up rate. We call it as a tachycardia. We say that I feel a lot of palpitation, that the heart rate has gone up. Normally 70 to 90. When it goes above 100, we always feel it. That is a fast rhythm. There is a slow rhythm also. That is a bradycardia or bradyarrhythmia. Sometimes there can be tachybrady also. Sometimes it may be fast, sometimes it may be less. Always when you feel that, you will have to check your pulse if you know that, or go to your GP or your doctor and they will check it and let you know. The cause also will be detected and it will be corrected. If it is due to a heart block or something like that, they may try to fix in a pacemaker. That is controllable. You should only go to your doctor.
Thank you, sir. That's all from our audience, sir. Before concluding today's session, any last remark from you?
Hello?
Hello, am I audible, sir?
Yes. Yeah, tell me.
Sir, I was saying before concluding today's session, any last remarks from you, sir?
See, my message to the citizen of our great nation is, heart diseases are preventable majority-wise. And sometimes a family or a genetic or by birth, there can be an issue that can lead to a heart attack. But your heart health is always in your hands, as I closed. How? There are only three things. Number one, you must eat less and eat right. That is fatty foods, oily foods, try to avoid, reduce the number. Number two, you must have physical activity. Even for doctors, I used to say that they should, after 50 years, they can walk in their chambers and see. As I said, even in your day-to-day life, you can incorporate this physical activity that you should do. Third is, never smoke or never consume alcohol. Fourth is, be happy. Be happy. Whatever problems comes to you, you be happy and don't be worried why this has come, how well. You just think, okay, this has come, this will also go away. be happy, be without stress. You will be having a healthy heart. Thank you. Thank you all.
Thank you, sir. With your permission, I would like to conclude today's session and thank you so much for joining us today.